In with Dr. Michael Lim, who is a good friend of the show. He is also a world-class heart surgeon, and he is a cardiologist with SLU Care and SSM Health SLU Hospital. Good morning, Dr. Michael Lim.
Good morning.
Good morning.
You forwarded us an article which caught your eye, and that is mortality rates when it comes to children and babies here in America.
Yeah, so not really great news, I guess I would start this on, and eye-opening. The infant and child mortality rate in this country is so much higher than any of our compatriots across the world. And this is even despite spending significantly more money and throwing more money at children's health care and infant health care. And the mortality rates are just several-fold higher than the other industrialized countries across the world. We're losing. This is losing.
Any age group that is more at risk?
So it sort of depends on how you want to look at it. So there are pockets within the country and within St. Louis where we have really, really high infant mortality rate. So the really young ones. And there's some correlations with lack of good prenatal care, lack of good early childhood care, basically healthcare deserts, kind of like food deserts we talked about before.
Right.
But I mean, then as we grow older, though, we do have food deserts. We do have real problems in terms of our kids' nutritional status and being able to get well kid visits, get immunized, get protected against the flu, be properly fed. It's about 60 degrees today, but just last week we were talking about the cold. These are the people that are most susceptible to those types of things.
So are you saying that let's take St. Louis, for instance, you're saying in St. Louis, depending on where you live, the infant mortality rates are that drastic, they're that different in where you live in a community?
Yes. It's striking. There's maps that exist, and you can draw the lines around those areas that you can predict. It has a lot to do with the income in the area,
right,
or the poverty of that area. We have serious problems here in St. Louis. In those areas, we're not taking care of those people.
How much of that is, and this is not a political show, but how much of that is lack of health care, lack of access, and how much of it is lack of knowledge, or how much of that is the responsibility of the mother versus society?
Well, I think the thing that we can say for sure is that the other industrialized countries that are beating us in this have taken this on as a societal issue, saying that we believe that taking care of our young in whatever way necessary is important. And they've taken that on as a task. You say this isn't a political show, but I think this does become a political topic because healthcare has become so politicized. And there's crystal clear lines which are drawn with respect to, well, this is good and this is bad, and this works and this doesn't, and this is evil and this isn't. And all of this falls as basically silent victims of the politicalization of healthcare. And then I was thinking on my way up here, it's also the education system. So our public education system, especially inner city schools, have also been seriously politicized over numerous number of years. Oh, the inner city schools stink, and their school boards don't do this, and their funding is and all of this. And so when we do this in our society, we make these political topics. I think we do put, say, a mom in a bad spot.
Right.
How are they supposed to know? And how are they not supposed to feel like they're the bad person? And so I don't know where you turn to.
Yeah. Well, it's not just urban. It's also rural.
It is.
Because rural, we're seeing now that some of the worst death rates, some of the worst mortality rates, some of the worst life expectancy is showing up in rural America.
No, that's correct. There's a tremendous doctor shortage and healthcare shortage. Even in Missouri, there's 99 counties, I think I just saw, within the state of Missouri, and the vast majority of them are rural counties, and they don't necessarily have the same type of access to health care.
Right.
And so It's a different issue than the ones that are closer to our studio here, which are more inner city related, but still the same type of problems, I believe.
Yeah.
And that is the politicalization of these types of issues, where we've created a system where, this is my own personal belief, okay? That's my disclaimer. But you hear everybody who wants to run for public office, they want to talk about a middle class. But over the past many, many, many years, what we've had is just a degradation of that group, and we've basically expanded on a concept of the haves and have-nots, right? So we've isolated the middle, and we've just created the two extremes. And I'm not saying anybody's at fault for that, but I think it's time, and that's the point of showing this or talking about this article today. It's time to kind of just wake up a little bit, say, wow, this is what's going on in our country.
What I find most interesting, and take these numbers, it's the similarities in rural America and in urban America, right? You talk about food deserts. It's not just in urban, it's also in rural. You talk about infant mortality. You talk about drugs and alcohol and lack of opportunity. You could be. You have to ask. Are you talking about inner city or are you talking about rural America?
Yeah, because you're talking about it all.
Right. And rural America and urban America have the same problems, and they're at each other's throats.
They are, because who gets what? The dollar. Right. Where do you put the dollar? Right. So the programs that are talking about that that are currently being discussed right now. So the CHIP program. The Child Health and Infant Protection Program. The federal government has not funded it and has not renewed the funding. There's millions of kids who are potentially without health insurance and coverage from that standpoint. The opioid crisis and the issues with respect to treatment and ability for people to turn to with drug addictions and substance abuse issues. Again, just very, very similar. Rural America, urban America, same kind of thing. These programs are underfunded and basically turned into hot potatoes.
Yeah, and now child mortality is, it's not very good.
So we're going down.
We're going down.
It's time to wake up, or sort of, I hope the listeners can hear the call. So we should be able to do better than this.
Mm-hmm.
Dr. Michael Lim is a cardiologist with SLU Care and SSM Health SLU Hospital and a friend of the show.